Well, long COVID is when someone who's infected experiences unexplained health problems for months afterwards. The VCU School of Nursing is leading the research, trying to see how and why long COVID affects specifically kids and young people.
I love talking to people. I love hearing people's experience.
As a people person, Brett Brooks enjoys interviewing families with a mystery.
So they're trying to find answers, and being a part of this study is going to help them to be a part of finding that answer.
Brooks is part of a VCU research team leading a national study into long COVID, specifically in kids and young adults.
But it's kind of like giving them hope that they're a part of the answer and somebody is looking at this and figuring out the best ways to help them going forward.
You know when you're sick with COVID, especially now, oh, it's like a bad cold, right? You've got sore throat, maybe you've got some respiratory, but long COVID can take any form, right? Because it's any symptom that can occur after you've had this infection that you didn't have before.
Dr. Amy Salisbury is the lead investigator on the study. She says it seems like those with severe COVID infections or pre-existing health concerns might be at a higher risk of long COVID, but it's still impossible to say who will develop it or why.
I think we have a little bit more data now than we did a year ago, especially for adults. But in children, I don't think we have the data we need to really say, oh, here's what can happen if you're in a particular risk group or not, or these are the factors that can point to you maybe having more trouble after you've had an infection.
The study is looking for families with people 25 or younger, whether or not they're actively dealing with long COVID. Participants will share blood and saliva samples as well as health information over the course of a couple years.
You know, being able to look at the immune system, the nervous system, and how those things interact together. This study is our opportunity to look at the systems and how they interrelate to each other, rather than looking at it at a mechanistic level with one thing at a time.
That multi-system analysis, the researchers say, should help provide treatment and predictor factors for long COVID.
Hopefully we'll have more information about how this works so that we'll be better prepared for the things that are coming down the pike for us to deal with.
So this is a really key moment in history, trying to figure out how we can best help these individuals.
Participants are paid for taking part in the study, and the School of Nursing plans to set up community events to talk to interesting parties very soon. Families are able to enroll currently right now, so we'll put more information on how to do that on our website, WTVR.com.